Well, congratulations. You've made it so far. The last step is just to do the final polishing on the teeth. We're going to polish the lower dentition just like what we did with the uppers. I'll start out first using my polishing blue cup. That's going to help really open up the facial embrasures, smooth off the linguals, and it's great for working over the buccal cuss tips that you built up. I'll show you that. And then we'll finish up with our silicone brush. I'm going to demonstrate that. You already understand how to do that based on what we did on the upper arch, but I'll briefly show you how I do that. But I do like to show with these cups how they really work really nicely over these cuss tips. So you can use these cups, and these are the Flexi cups from Cosmetic, and they flex. So they're really nice for flexing around and helping you blend that composite onto the tooth surface. Especially going down into the occlusal area, you can really get that cup to flex. Now in your kit, besides the blue cup, we've also included the pink cup, and the pink cup is the fine polish. So after using the blue cup, you can go in with the pink cup. Now going around to the anteriors, we can use that same blue cup as we did on the uppers and just blend that composite into the facial surfaces. We can use it to open up the facial embrasures a little bit, using the side of the disc to polish the incisal edges. We'll work our way all the way over to the other side of the arch. Again, working into the lingual as well. Now remember to go into the lingual of the lower anteriors and make sure that you're polishing those. And again, I'm using the side of the cup as my assistant is retracting the patient's tongue to protect their tongue. So we'll rinse that off. Go in with my silicone point next. So when we finish, it'll look something like this. And what's nice is that this composite just blends in so nicely to the tooth structure. The last thing that I do with the patient, I'm going to go back and I'm going to use the interproximal polishing strips. Remember, we used the diamond strip and the plastic strip when we did the upper arch. I would do the same thing on the lower arch or in between each of the teeth and make sure I polish, follow up with floss to make sure that it's nice and smooth. And as we look at the new vertical dimension, look at the overjet and overbite, and we compare this to our preoperative model. We see the worn dentition, and we see the restored case, and as we open, you can see the occlusal form of that lower arch. All right, dental online trainers, go ahead and finish up that lower arch, do any final contouring, and do the polishing. Use your blue cup, your pink cup, and that silicone point. Go back to the upper arch for any areas where you adjusted and polish those areas as well. Finish that up, and I'll see you at the next module.